Okay, I think we can go ahead to start because I can see that Gorka has joined. Hello, everybody.
Hello.
And thank you so much for joining today's session. My name is Ikwa Inkum. I am the program coordinator for the Ayoka Fellowship. And today's session, we are going to focus on health innovation because that's the field that our fellow Tatiana is working in. Throughout this whole week, we've had different sessions on business innovation and e-learning, women empowerment, youth empowerment, and migration. And so I'll start by giving a brief overview of what the Ayoka Fellowship is. So it's an initiative which is part of the Puerta de Africa Foundation, and it is a collaboration between Casa Africa, which is part of the Spanish Ministry of Foreign Affairs, and Puerta de Africa. And our mission is to create a platform or a space where young entrepreneurs or young leaders from Africa and Europe in general, we're starting from Spain, but Europe in general, can come together to share ideas on the different projects that they are working on in their communities, to co-create, to exchange ideas, and to learn from each other. And so we created the Ayoka Fellowship about roughly a year and a half ago in 2021. We selected 12 fellows from different countries in Africa and from Spain as well. And they're working on different projects. Like I mentioned, we have some fellows working on migration related projects. We have some working on women empowerment. And we have today our fellow Tatiana. I don't know if Tatiana, you can hear me, you can confirm. I can see that you're on the call, just to confirm that we can hear you.
Hi, I can hear you.
Perfect, thank you. And later, Tatiana will be telling us about her project and will give us a short presentation as well. And for today's session, we have invited guests. We have Laura, please forgive my pronunciation. And just so I can introduce you properly. Yes, so Laura de Dilectis. I hope I'm pronouncing it correctly.
Yeah, it's right. That's right.
Great. And Laura is the CEO of Viola Walk Home and the founder and president of Donextrada. I hope I'm pronouncing that correctly as well. And Laura is a passionate clinical psychologist who has always been fascinated with the human soul and the complexities of the human experience. And after completing her studies in Rome, Paris, and Lisbon, she dedicated her life to helping people in need and promoting positive change in society. Driven by her passion for social justice and her desire to create a safer world for everyone, Laura founded Donextrada, a nonprofit association that works to combat gender-based violence and promote gender equality. Through this association, she has developed a range of innovative tools and strategies to support victims of violence and help create a safer and more inclusive society. One of the most successful initiative developed by Donextrada is the Purple Point Network. I'm sure Laura can tell us more about it later. And it provides specialized legal and psychological supports to victims of violence. Additionally, Laura and her team have organized a range of events, campaigns, webinars, and workshops to raise awareness about gender-based violence and to promote social change. Another groundbreaking initiative developed by Laura is the Viola Walk Home service, which provides live Instagram video support to anyone who feels afraid or unsafe in the streets. This service became viral in Italy and has since been extended to other European countries where it has helped countless people feel safer and more supported. As the vice president of Donextrada and the CEO of VSRL, Laura continues to use her skills and expertise to develop new technologies and tools to promote safety and well-being. Her latest project, the Viola app, is an innovative video calling platform that aims to revolutionize the way people stay safe and connected in an increasingly complex and changing world. Through her work with Don Extrada and VSRL, Laura has demonstrated her deep commitment to social justice, human rights, and the well-being of all people. She is a passionate, curious, and visionary leader who continues to inspire positive change and make a real difference in the world. So thank you once again, Laura, so much for joining us today.
Thank you for inviting me.
Okay. And another guest we have today is Gorka Goichea. I don't know if I'm pronouncing it correctly.
Very well.
Thank you. So Gorka is the director of ESG Investment Management and Impact at ANESVAD Foundation. He has a degree in advertising and a master's in marketing from the Valencia Polytechnic University. He joined ANESVAD in 2010, where he has specialized in ESG investments and social and environmental impact. He was part of the project to transform the assets to 100% socially responsible investment strategy. In addition, he's the secretary on the Ethical Investment and Social Impact Advisory Board. During the period, he has led the launch of the venture philanthropy project We Economy Impact, which supports African social entrepreneurs and co-leads the Foundation's Fund project, a project in which 20 entities are supporting social entrepreneurs in Spain. The ANESVAD Foundation is a development NGO focused on neglected tropical diseases in sub-Saharan Africa. It has been associated with the European Venture Philanthropy Association since 2015 and the African Venture Capital Association since 2020. It is also a member of Spain SIF and the board of directors of Spain NAB. It is also the first foundation in Spain to sign the United Nations Principles for Responsible Investments. So thank you again so much, Gorka, for joining us today.
Thank you. Thank you for inviting us and for having the opportunity to be with you this afternoon. Thank you.
I also know that you are here with a colleague, Anna Martin. So I wanted to say welcome, Anna, as well. And thank you so much for joining us. We look forward to your contributions.
Thank you.
We also have our last guest speaker for today, who is Oluwakemi Ebire. I can see that she's on the call. I hope I pronounce your name also correctly. Thank you. So Oluwakemi is a care specialist from Pharmacy Africa, and she's a licensed pharmacist with years of experience in clinical and psychiatric care. She currently spearheads patient care in Pharmacy Africa, ensuring personalized care delivery to people with recurrent medication needs. As a member of the Federation of International Pharmacists and an alumni of the 2022 FIP Mentorship Program, she served as the Public Health Coordinator for the Pharmaceutical Society of Nigeria, Young Pharmacists Group, where she addressed health issues through consistent community engagements. She is passionate about global health concerns and research on deep novel treatment options, and her goal is to leverage technology to solve challenges in healthcare. Once again, thank you so much, Oluwakemi, for joining us. And thank you everybody else for being here on the call today. The last person I will introduce is our fellow, our Ayoka fellow, Tatiana. And Tatiana is a web developer, a techpreneur, a founder, and the project manager of Tokam. Tokam is the project she used to join the Ayoka Fellowship. And she is a current project management student. She worked as a customer service representative for 3 years, and she's a global peace ambassador with the Global Peace Chain and the global youth ambassador with Their World. So thank you again, Tatiana, for joining us. And later we will hear more about Tatiana's project when she presents to us. So we will hit the ground running with short Q&A sessions where we discuss a bit about health innovation, and then our guest speakers can give us their inputs. And Tatiana as well, if she has any questions for them regarding health innovation in Europe, in Spain, and in Africa, in Nigeria, and everywhere else. So I will start with the first question. And that is, what do you, our guest speakers, think are some of the most promising health innovations that are currently being developed in Africa and Europe? And how can we ensure that these innovations are accessible to everyone who needs them? So I don't know who wants to go first. Maybe Lara wants to go first. Some of the new health innovations, perhaps in Europe.
Yeah. So I think we can do the same. I can start every time and after Gorka. Yeah, we work in health. Me, for example, as a psychologist, I'm not working really in health innovation, but in security that is connected to health, of course, to psychological health and feel of fear of security in the street. What I know that is happening in Italy and all over Europe, it's the fact that technology is really joining the health innovation. And I think we must a little bit change the idea of using technology, because normally it has to help to improve quality of life. That's exactly the sense and the meaning of doing something in health innovation. And they're doing a lot in mental health and well-being. So not only the kind of health that can be something like having a problem, like physical problem, but also the positive part. So being well, as we know, health is not only not having something like mentally or physically, but is also staying in a well-being, mental health and physical health. So it's even more than before, the important impacts also in our working place or in scholarship, the fact that people has to live well, all the kind of sense. And I think this is the way we must think from today. And this is the innovation that I'm seeing right now.
Great, thank you so much. I don't know if Gorka or Anna wants to add anything.
Yeah, let me just put a point in the second part of the question. Okay, I think that health innovations must be accessible to everyone to be real innovations. So any kind of innovation we have to be clear on that part, and no, don't leave anyone behind. Okay, we are very committed, for example, with the people affected with the entities, as we mentioned before. We are an NGO focused on neglected tropical disease, and we normally working in very rural areas. We contact them through local NGOs, and we are very committed on that all innovations arrive to them. Okay. Regarding the innovation, I would say that we have in our area, we are seeing a kind of new treatments. For example, we have just recently known a mystery cream to protect against malaria, because it was like for 8 and 9 hours against the mosquitoes. So that's a good point in Africa if we can spread it to the rural areas. We have also a cream to protect persons with albinism from skin cancer, which is a great problem in Africa, because most of them, they don't live more than 30 years old because of the skin cancer. So this special cream to protect persons is a real innovation that is important. I would say that there are another kind of innovation related to improving real actual treatments, new diagnoses to detect different diseases, in our case NTDs, or we heard about a new tuberculosis drug that is working by 2 labs from Korea and UK. And in our case, we have a treatment for the Buruli ulcer, which now is 8 weeks treatment, and we're trying to shorten it to 4 weeks. So it's a kind of improving new ideas related to the one. And the third area that I will remark is technology, as Laura said. Okay, health tech, apps, telemedicine. It's great, and I think it's going to be crucial in Africa. For example, we have the teledermatology to diagnose skin diseases in remote rural areas. That's very interesting because if we don't have that kind of new tech, we have to go to that rural areas that are very difficult. But let me remark the first idea. Okay, any of this innovation is it's going not to be really, really interesting if they are not accessible to everyone. So we have to work with a public health approach to really spread it everywhere.
Excellent. Thank you so much. One of my main takeaways from today, that health innovation has to be accessible to everyone to be considered innovative. Thank you so much. I don't know if Anna or Oluwakemi wants to add a different perspective to that.
Hi, I'd like to confirm that you can hear me.
Yes, we can hear you.
Okay, good. So Laura and Gorka, I hope I pronounced your name correctly. They've said it all. There are so many innovations currently in health tech space. And if we decide to bring it down to Africa or to even Nigeria, my home country, we have healthcare innovations that are currently catering to so many different sectors and aspects of healthcare. We have medical devices, we have medications that are currently catering to maternal care. So there's, I don't know if you've heard about the rate at which postpartum hemorrhage is very, very high in Africa. And then people are taking steps to say, oh, okay, how can we supply blood medications to pregnant women and women that are about to give birth, so that they don't have to bleed to death, so that when they need a specific blood genotype, so when they need a specific blood genotype, yes, they can easily get it. So people are thinking in that direction. Where I currently work right now, Pharmacy Africa, they're focused on using telemedicine, telepharmacy to provide accessible and affordable medications and personalized care. So there's so many innovations with last mile care, the innovations around non-communicable diseases. I heard Gorka talk about malaria. I think there's a brand in Uganda that is called Organics, and they're focused on using herbal plants rather, to create mosquito repellent soaps. And I feel like that is very innovative because that gets to the grassroots. We're talking about how to use digital tech, digital tools and services, but then other people are thinking about how to actually get this innovation to the grassroots. Because Gorka mentioned how innovation should be accessible to everybody. If it's not accessible to everybody, it is not necessarily an innovation. And I 100% agree. And I also think that quality healthcare is not negotiable. Everybody at one point in time needs quality healthcare. Yeah, that's what I have to add.
Thank you so much. Looking at the technological aspect to it, I think maybe, I don't know if you see some challenges, especially making it accessible, since in the rural areas, for example, they don't have access to internet and technological applications and all of that. So I guess I will use that to move into my second question, to how or what role can digital technologies or data play in accelerating progress in health innovation, and how can we ensure that these tools are used ethically and effectively to improve health outcomes, especially in rural areas where it's not available? I think Laura can go first. Yes.
Yeah, I'm gonna start. Yeah, my thing is that research is everything, also for the inclusive part and the accessibility, and also with the solution, because we need to ask people what they want, what they need. So do qualitative interviews and quantitative interviews. And a lot of time we need to use technology or social media and everything that we have in this kind of way, not as a goal, but as a way to reach people, to reach everyone and the need of everyone. And a lot of time I see that we don't understand the problem really well. We don't have a lot of research about it, for example, in gender violence. So you can see a lot of institutions like in Italy or all over Europe making maybe the wrong project because they didn't have the right questions about it. Our example, just to have an example as what we are doing, that is kind of connecting everything that we are talking about. It's just having a problem and having a solution, like practical solution, contemporary solution, like using technology, using social media. And that was the meaning of what we were doing, because we wanted to reach everyone. So we started from Instagram, so social media, because a lot of time institutions spend a lot of money to do communication about gender violence, about anti-violence center, etc. And even with that, they don't reach the people that maybe can need, because maybe this kind of person is not near to the center, doesn't know all the things, the opportunities that are available. So we need to communicate in a different kind of in a different way, and asking why something is not working. If it's not working, this is never stopping, always on doing project, because you need to change, because reality is changing, and we need to talk and to listen to people.
Exactly. Thank you so much. The point you mentioned about research and understanding the basic problem is something that we've taken very seriously in Ayoka, for example. So the first stage of our fellowship was making sure that the fellows understand the problems, like doing research into the actual problems that they are trying to address with their project. Because like you said, if we are creating projects and solutions and we're not done the research, we are just creating things, there will be problems and we'll not be addressing the problems that we are trying to solve. So thank you so much on that. Maybe Gorka wants to go on. Yes.
Yeah. Yep. That's a really good point, because when we think about digital technologies and data, we always think about the technical idea, no? And I can give you an example. For example, we developed an open source app to collect data in rural areas in South America and Peru. It was for the control of the dengue. Until we had that app, or people needed to go to the rural areas, take them, write them, go back to the office and put them in an Excel. And it was very difficult to do it in a proper time. So the app shortened that time, and it was very interesting to improve the treatments. And what we did technologically it was an open source app, working with the health minister and trying to put it in the rural areas and in all of the health establishments. So as it was open source, it was accessible. That's the point. But I think that there is a more interesting part that Laura pointed out, is knowing the real needs of the communities itself. So I think that we have to identify the needs of the communities, and if they are not able to participate, the civil society that they represent this population have to also work on that and give us the proper information. And we must be very, very focused on being accessible for all people and equitable, ensuring that women have the equal access to men, for not only for the treatment, but also for this part of receiving the information, so that we have the real community needs on that. Okay, so the right-based approach or the gender equality approach are very, very important for having a non-discrimination principle on that. Okay, and we do normal apply this very, 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 very strictly in our cases, because the people who have suffered an entity or they are suffering now, they normally have disabilities, so they have a social stigma in their communities. So we have to take this very in account always. Okay, we prioritize these vulnerable people, and we have to have a very important emphasis on women, children, and people with disabilities for the treatment, but also for the first time or the first part of the creating the real problem information.
Thank you so much. Oluwakemi, I don't know if you want to add I don't want to say African perspective. Africa is very broad, maybe a Nigerian perspective.
Okay, yeah. So for accessibility of healthcare innovations, I think that I already said it before, digital health tech services and tools are very, very important. In Africa, in Nigeria, they've made things easier and simpler. I saw 25% of doctors have been, the load on them have been reduced since telemedicine came into play. So when you can have conversation and consultations with your doctor from your place of comfort, it reduces the burden, or like the patient-doctor burden that the doctor has to see every day. So the use of digital health tech is very, very important. And when we talk about places where digital health tech cannot get to, then we can introduce grassroots participation. I think that a lot of healthcare innovations can get to the grassroots, especially through awareness. So when we say digital tech, most times we always think, oh, okay, it has to be very sophisticated. But then currently you can dial, say, pharmacy, you can dial 0700 ask pharmacy, and then you are connected to a healthcare specialist that can help you with medications, and it can direct you to how to see a doctor, all of those things. So I think that is very important for access. The second question that you asked about, I think it's about how to, I'm not sure how to curb, how to regulate, yes, healthcare innovations. For an example is, say, medical health records. There is the place of consent, like explaining and getting consent from your patients before you say onboard them into your system. And another point I think that is very important is the place of regulations for the health medical health records. Not everybody should have access to those records. It should be just the specific people, say like the care specialist and the doctor. It shouldn't, the medical records should not be accessible to every other person on board or on the team. So those are the points I just wanted to add. Thank you very much.
Thank you so much. Okay, moving on to our next question. I think all the organizations represented here are maybe non-profits. So it would be interesting to know how you as your organization are collaborating with different or other private sector actors or governments, and how you're working together to build a robust health innovation ecosystem that fosters collaboration and drives progress within the field. Are there challenges you are facing when you have to collaborate with, I don't know, the different governmental ministries and all that, and how are you working through these challenges?
Yeah, I think I have a different experience from Gorka, we're gonna see. We born 2 years ago. From the beginning, we start to a dialogue with institutions in all kinds of ministers, can be also the city, I don't know the name in English, so the smallest institution from the district or a city. And we talk almost with kind of everyone, because what we do is about health, is about public safety, is about instruction like education, gender equalities, etc. What we notice is kind of what you can see also in a university. Everything is so slow. And when you work with public, it's really slow to make change and to do something. And that's why actually we started the project, because we don't have time to wait 20 years to have different solutions about gender equalities. People are actually dying just coming back home. Sarah Haberard, when the project started, she was raped, and killed in London by a policeman when she was going back home. And we have a lot of cases like this also of domestic violence, etc. So we really don't have time to talk a lot and to have table discussion, etc. Of course, the real solution in our example is about education, is going to the school, etc. But we can also have more practical solution, as we said, with technology, as for example, our video call. That has a really important role because it's work on prevention, because if you are in a video call, maybe an aggressor not gonna actually harass you because they're gonna know that there is a testimony, and that can be approved in a legal way because there is a video recording. So it just mixing everything that we can do with technology and at least doing something. We still continue a dialogue with them. We receive an important recognition from institution, from a big institution, because it's an important law in Italy, legge di bilancio. We received 200,000 euro. But to have a non-profit organization that works on gender violence and street safety, but not only us, everyone actually in Italy, they really need a lot of money because it's a work. It's not an hobby. It's not something that we do just because, I don't know, you don't work in a company. And this, I think we need to change this fact. We notice a lot that in Italy maybe can be, seems like you are a volunteer, seems like you are doing something during Saturday because you are a volunteer in an NGO. So we need to change the perspective about seeing the no-profit organization that is doing a lot, and a lot of time is like just filling the void that the institution keep from the society. And we just, in our example, but also in others, different NGO, we are doing the work that normally they should do. And this is a problem. So a lot of time is politically, a lot of time is just making something one day just because it's the International Day of Gender Violence and after nothing else. We need methodology, and we need all the kind of technical people and the professionists talking about it, because it's a serious problem.
For sure. Thank you so much. Maybe Gorka wants to add up.
Yeah, I would say that the key word in this case for the different actors is in the question, is collaboration. No one of the actors mentions can do it anything by itself, and we need to collaborate with the health sector, for example, in different gaps, and trying to put their capabilities, but the private sector also engaging on the social purpose and the impact, and the social organizations like we are trying to doing like a catalyzer of all of them, because we normally tend to pretend that the role of the African states is greater than what they can do, although they can be really capable, no? Because they are often weak. There are some problems in internal problems. The budgets are really limited, and the foreign debt is very, very large, and also international aid also always comes with tons of responsibility. So the limits of the spending is high, you know. And I think that we have to promote these multi-stakeholder spaces for exchange, for reflection, for activity, for listening to the affected population, integrating in these multi-stakeholders also the patients or the people or the communities to bring their ideas, and trying to have this kind of ecosystem innovation spaces to bring all the info, and then to create from there, also collaborating and putting each one. We have normally collaborations for a long time ago with social civil organizations in Africa, and we do a call for proposals with the traditional way of for the local NGOs. We have strong relationship with the 4 countries ministers where we are. We are now trying to work with them with a result-based finance way of collaborating, not the traditional one. And we are also incorporating now the private sector. And if we have time, I can give you the example later. But I think that we have all to work in alliance, creating or establishing good alliances between all different actors.
Great. Thank you. Oluwakemi, can you share your experience maybe collaborating with the different actors in Nigeria?
Okay, yes. So I agree with all that has been said. Collaboration is the key word and it's very important. I mean, there's no monopoly to healthcare system. You cannot do it alone. You have to bring from here and bring from here and put it together for it to make sense. Whether it's the private collaboration or it's the private-public collaboration. While collaborating with the public sector, that's most of the government, can take a lot of time. It makes sense to work on a lot of private collaboration. For example, pharmacy, we simplify medications through personalized healthcare, and we have collaborated with a certain company, My Cover AI, that works on insurance. So we've partnered with them to create like an insurance product that our customers can have access to whenever they have, like, say, an emergency need to see a doctor or see a dentist or see a gynecologist for whatever reason. So just by paying just a certain amount of money, a top up to the normal amount they pay every month, they have access to that particular product. Remember listening to our customers' needs, and they talked about how they would like a mental health package, because even though most of like their other insurances give them packages for mental health, it doesn't cover like psychiatric or therapy. So listening to problems like that, and then like partnering with companies to solve all those problems. Pharmacy also partnered with Cafia. It's a company that is focused on primary health care. So where say you need to get vaccinated, they have healthcare workers that can come to your home and give you these vaccinations you see, and everything is done strictly under like the ethics. Everything is done correctly. So it's licensed health workers coming to your home. They're giving you convenience, and they're killing that wait time, that long wait time in the hospital. So yes, so I honestly think that collaboration is a very big solution to solving most of our problems. While public government addition is also very important. I feel like when a lot of private companies come together, in due time, they have a voice that is loud enough to influence the public sector. Yeah, thank you.
Thank you so much. I feel like there's a lot I'm learning here as a lay woman who works outside of health innovation. So thank you so much. We will move along because of time to hear Tatiana's presentation about her project, and then afterwards, maybe our guest speakers, Lara, Gorka, Anna, and Oluwakemi can give your insights into her projects, maybe advice, and what you think about her project in general. So Tatiana.
Yes. Good afternoon.
Over to you. Good afternoon.
Okay. So let me move right into it. Welcome everybody. I'm glad to be here. So with the coming of COVID-19, I did notice the rise in cases of gender-based violence and the deterioration of people's mental health as a whole, as the situation was really overwhelming. With the little I knew about gender-based violence and mental health matters, I decided to do more research on this, and with my focal point being Cameroon. From my findings, I gathered there is an increase in gender-based violence in this 21st century, which has caused like untold pain to mankind, and most of this violence defies basic human rights. The statistics I got from this were really disturbing. Among the many cases of gender-based violence I had about 55% resulting from physical and sexual intimate partner and 33% from non-sexual partners. And it should be noted that this statistics is not recent, and it clearly sidelines men as victims of gender-based violence. It is against this backdrop then that I decided to build a digital platform that provides a safe space where victims, survivors of gender-based violence could report these cases anonymously, given gender-based violence is underreported because of either fear or shame. Offer a space where we could encourage men to speak up without shame, as we believe our solution will be more sustainable if we have men as allies, if we also give men a space where they could talk about these cases of gender-based violence, given most of them don't report these cases. The platform allows individuals to book for psychological follow-up, that is mental health therapy and counseling, while letting human rights activists, counselors, therapists sign up on the platform. We work mostly with campaigns, workshops, that is digital or on-site campaign. We have our regular school tour because we are aware of the violence going on right now, because right now in Cameroon, the cases of violence in the school milieu, like it keeps increasing daily. So we decided to have a school tour where we engage these students, we talk to them, we create awareness, let them know how TOCAM can be, sorry, I think I have noise on my background. We educate them on the importance of speaking up and how TOCAM can be a bridge between the problems they think they will not or cannot voice out and the various solutions which they seek. We did visit private and public universities, secondary schools, where for the past 2 years, we've reached out to about 50,000 students. We have our digital campaigns where we work in partnership with bloggers, radio and television houses. We have our mental health campaign. Since one of the main goals of TOCAM is to promote and valorize mental health, we thought it necessary to constantly reach out to health personnel, since they have an obligation to denounce and debunk violence and promote mental health and create awareness in our communities. We bring together and engage these medical personnel. We get feedbacks and propositions on how we can directly use their medical expertise on and out of the platform to combat violence and create awareness around mental health. Right now, we are working on our mobile app. We have a web app which is functional. We are equally implementing presently the Robin Hood business model as a sustainability plan for the project, in a way that we will be selling monthly and yearly plans of mental health and therapy and counseling sessions to multinationals, prisons, NGOs, and individuals through our platform. In this way, victims, survivors of gender-based violence can have access to our services at no cost, as a means of us reintegrating back these survivors back into the community. We do offer career coaching too on the platform. Career coaching, we train some of these girls, mostly survivors of gender-based violence, on hand-on digital skills as a way to reintegrating them back into the community, because we did notice that most women who are really in horrible, for example, domestic violence situation, is because they lack either a craft or they lack a good source of income. The reason why they stay in the abusive relationship. So we create awareness too on the importance of men speaking up, and we are trying to create to have honest conversations around gender-based violence, because on our part, we notice that gender-based violence keeps increasing, because we really don't talk. Most often the conversations are around the after effects of gender-based violence. We don't talk about the causes, like we ignore the root causes. So I just think until we have honest conversations around these push factors, the cases of gender-based violence. Thank you.
Thank you so much, Tatiana. And so Laura, Gorka, Anna, I don't know if Oluwakemi is still here, but if you have any insights, any questions for Tatiana, any advice?
Oh, hi, can you hear me now?
Yes, we can hear you now.
Okay, hi, Tatiana. Hello.
Hey,
How are you today?
I'm fine, thank you.
Okay, great. It's great to meet you. So first things first, I just want to say well done. I think that you are solving a real problem. I remember Laura talking about how some problems are like solutions to some problems are not real. I think that there's an actual problem, there's a real problem that Tokam is solving. And I think that you are very brave. I particularly have connections to this problem because I'm a woman and I understand how like domestic violence is very gendered, it's a gendered crime. So I definitely understand the aspects that you are coming from, you see. I think I have one question here, and that question is, what's the long-term plan for people that, how do I explain this now? Okay, so you know the thing with domestic violence, even after you can report anonymously, there is still going back to that environment. There's still the chance of going back to that environment. So is there like a long-term plan for people that start to report anonymously and then you know that, oh, this person is reporting again, this same person is reporting again? Are there like plans moving forward for that person to say, oh, okay, I would like to look into your case specifically and see how we can do something to maybe take you out of that environment if possible, just so that it doesn't repeat itself? I don't know if you understand the question.
Yes, I do.
It's okay if there's like no concrete answer to that. I just want to know if something that you're already thinking of moving forward.
Yeah. Yes, of course, it's something I'm thinking of and which we are working on already. We are trying to create referral pathways with other organizations that are already working on gender-based violence, where we could remove some of these victims from those environments. With the referral pathways we are going to create with these organizations. At the moment, right now, what we do at our level is when they report these cases, since we don't have these partner organizations yet, we follow up the cases. Those who need those, most people reporting on the platform right now are people who just want to share their stories, are not people who actually really need help. But we've had few cases of people that really needed this to be followed up. We do the following up ourselves. I have a team, though my team is made up mostly of tech experts. So we do follow up these cases ourselves. And these victims, if they are people that need mental health follow-up, we do the mental health follow-up. It's free. And if we see that this is a case of somebody, of let me say, either it's a man or it's a woman who need something like a job to sustain themselves, if they have the credentials, we link them up to job opportunities. The ones we have at hand, we link some of them to job opportunities. Then we train some of them on digital skills, as I said, so they could have like any skill we think they can use on their own to make money without having to work for somebody. Right now we have 15 girls, 10 boys. We are training on digital marketing and graphic design. Did I answer your question?
Okay,
Yes, you did. Oh, yes, sure, you can go. I'll go after you.
Great. Okay. Congratulations, Tatiana, for the project. It's great to see how has it has gone, and how can you put it in different kind of students, like studios and universities, and I think that and the long time that you have been working on that, and that's a good point. So congratulations. I have like two questions. Okay, one is related to also the anonymously reporting, and how do you manage after with the psychologists that's anonymous, and how people who are firstly reporting in anonymous, how do they do the step to go to the psychologist and lose their anonymous moment on that? Okay, that's the first question. How do they feel on that? And the other one was if you can elaborate more about the Robin Hood model, just to understand better how it works.
Okay, the first question, if I got you well, how they move from reporting anonymous to going to having sessions with the therapists. That's it, right? Okay. Most of these cases that are being reported anonymous is because if you register on the platform now, every case that has been reported on the platform, you can see it. So the main aim of people reporting anonymously is because they don't want their identity to be known by other users on the platform. But we get to know who is reporting the cases. We have their details and everything, so we can reach out to them. When it comes now to the booking of the therapy sessions, if I book a therapy session with a therapist, another user can see I did book a therapy session with the therapist. That's my personal data. The therapist only know, okay, this person books a therapy session at this point. So right now we don't have we don't have that feature yet where people could book for therapy sessions anonymously. Because I think if you need to have a therapy session with somebody, if you need healing, you need to be open about it. As for how the Robin Hood business model, Robin Hood is a business model, like several business models, where let me say I can sell this phone. I have a product of high value. I sell it to people who can afford it at very high prices. So I could offer the services that they get from this to other people who can afford this free of charge. That's how the Robin Hood business model works.
No, I know the model. I just wanted to see or to understand better how do you apply it. Yeah, I know the model because you said some people is paying for the therapist
Yes.
in a higher price.
Yes.
Okay, that was what I wanted to catch better. Okay, I know the model,
Okay.
but I didn't catch really well who is paying more, and I assume that they are the ones who are paying less are the victims. Okay, but who is the one who is paying more, and which is the product you are selling to them?
Okay. So what we do is as we launch our mobile app, we are going to have more therapists sign up on the platform. We can even propose those services to mental health practitioners, clinics, where the mental health practitioners can sign up on the platform free of charge. Then we do proposals to multinationals like big companies. Where I work, for example, right now, we do have therapy sessions. Like you can talk to a counselor, like, let me say, once a month. So we can decide we want to offer these therapy sessions on a monthly plan, yearly plan to multinationals, NGOs, prisons, schools. Like they have a price they are paying for these monthly or yearly plans of mental health therapy sessions we are offering them. So from the money we make from this now permits us to sustain the project as the survivors or victims of gender-based violence. They have all those other services free of charge.
Okay, thank you. Congratulations again.
Thank you.
Hi, Tatiana.
Hi.
So,
hi.
Yeah, I just want to ask about the team. I know that you have about 3 years experience in customer service. So I want to ask about the other people that attend to this anonymous calls or messages. Is there any training in particular that they have to undergo? Is there something like that? Yeah, that's what I just wanted to ask about, because you already talked about the medical aspect. So I want to talk about your own team. How do you train to equip them? I mean, it's one thing to work in a space where you keep getting a lot of I don't want to tag it as bad things, but you keep hearing a lot of bad things. So like, how do you train them to receive that? And how do you also like keep a safe space for them?
Okay. Firstly, we don't have a free toll number on Tokam. We don't receive calls. We don't receive calls. We don't receive SMS. We have just people. We have the main features on Tokam are reporting of cases. You can comment. The comments don't go live. We actually filter the comments in order to put aside the insensitive comments. You can comment. You can book for therapy sessions. Those are the main features on Tokam. We don't receive calls. As for on Tokam, I'm just the founder and the chief operating officer. On the platform itself, those we have as workers are mostly web developers, mobile developers, be it front end, back end. Then we have the project manager who handles like every other aspect of the project. So when this case is coming, we have 3 people working on the back end. We have, I think, 4 of them working on the front end. When this case is coming, if it's a case that it's like it's an emergency, they get to the project manager. She can handle that in my absence. If it's something that needs my intervention, then I get to it. So we don't really, my customer service skills are really not, let me not say they're not in full use on Tokam, because we don't get to talk to these clients. We don't get to let me say, talk to them as they are not clients. We don't get to talk to these people, reporters or victims. We don't get to talk to them as I will talk to somebody on the customer service. When it gets to the level where they need to be handled and talked to, the therapy and the impact.
All right, thank you very much.
Thank you, Tatiana. We now have Laura and Anna back on the call. So if Laura and Anna have any feedback or any advice from Tatiana's presentation. Laura or Anna, do you have any feedback or anything?
Yeah, I was waiting for Anna. Yeah, sorry, I just read right now the email. That's why I connected now. Yeah, what I wanted to ask before, just in general, a feedback, because in Europe, and there is, of course, the need and the volunteer, the necessity of understanding, as I said before, the and the stories of people. So this is a really important part, the safe space and the possibility to share with other person and to also in a psychological way, of course, to work on the what happened. That normally is a trauma. Normally it's something that can last for a long time. So it's really good to connect this with mental health. Normally we work also with the legal part, and as you said before, so we connect not only mental health, maybe that can be a suggestion. So I don't remember if you said that you are doing also that. In Donna Strada, we have also the nutritional support, the gynecological support, and legal support, because normally the women can have the need at the beginning of the lawyers if there is an urgent situation. So that's the first part. The second part is the psychological, as you said, also in the school, but also prevention with women at the first stadium of psychological violence or domestic violence. So all the isolation and everything that a woman can have at the beginning, and can still cannot be murdered or something that is already stalking, is already harassment, etc. So giving them the tools to recognize, also with the workshop, with the training part, to recognize the affective dependence, the everything that a person can have in the past, also that can also put you in a situation, a relationship that at the beginning seems like normal, and it start to become toxic, not from one day to another. So it's always a process, and that's why it's difficult to recognize it, because you're just into it, and a lot of time friends don't know what to do. So maybe it's interesting also to do something for people that are not living domestic violence or something like this, like harassment, but the space between, so the social network of people. A lot of time, and people are asking me what to do in case of a friend that is living a situation of domestic violence or psychological violence. Maybe it's important to give to everyone the tools, also to parents, for the children, because a lot of time is during high school that everything can start. So it's a delicate moment of life, the first loves, etc. So maybe they don't understand the risk also, and all the part of digital violence, so cyber stalking, everything that you can have. So maybe we can do awareness in this sense, and can be a suggestion also for you what you're doing.
Thank you, Laura. I don't know
Thank
if
you.
Tatiana has any comments. Yes, no?
I don't think I have comments on what she said. So, what she said was well done.
Okay. And maybe Anna, any comments or feedback?
Yes. Okay, so first, congratulations, Tatiana, for the project. Yes, I really like how is it, how do you explain? It's very clear. I don't know if maybe I'm repeating something because I reconnect later than the others, but well, I don't know because in Cameroon, how is the national plan in gender violence, or how does it work, the laws, or if it's something like violence are also taken in account in the public system. But I don't know if you have planned to present this project in a public sphere, like maybe like I don't know, maybe in I don't know if there is like a council or district, or maybe to integrate this in plans based in for fighting against gender violence, or what are you working in your project?
Okay, thank you for the question. What we have in plan right now is after launching, when a mobile app is ready, which normally it should be ready. In fact, we did have a mobile app already ready, but it wasn't like the technology used on the app, I wasn't comfortable with it. So I had to get different people to work on the mobile app. So as soon as the mobile app is ready, we have plans of proposing this mobile app to the Minister of Public Health and the Minister of Secondary and Higher Education. We want to use this platform to in school milieus to create awareness around gender-based violence and mental health. Give these students, because there are a lot of things that happen in the school milieu which these students are afraid to talk about. And I think that is one of the reasons why we have the cases of violence that keeps increasing in Cameroon. And we also we are planning to present the mobile app, propose it to the Ministry of Public Health and even national security, because we want to use the app too for prisoners and in Kodiat. So that is something we have in the pipeline.
Okay. Okay, that's good.
Thank
All right,
you.
thank you.
Thank you. Thank you.
I don't know if anyone has any further questions or comments. Okay, good. At first, I thought it was a raising of the hand. Okay. Well, then I think we'll bring the session to an end. Sorry that we've taken 15 minutes of your time because of the interruption. We are very sorry about that. But thank you so much to Gorka, to Laura, to Oluwakemi, to Anna, and anybody else who joined, to Tatiana for, I don't know, more than 1 year of being with us in the Ayoka Fellowship. Thank you so much to everybody for joining the call. Right now we will have, okay, yes, we will have other fellows and other Ayoka team members joining to close international conference. So hopefully they should be joining soon. And our guest speakers can feel free to stay and close with us or leave now. But thank you so much once again. I'll let Vivian take over now.
Having listened to the session, thank you so much for your insights and for the great discussion we've had. And sorry for the small problems we've had earlier. So thank you also, Ekua. Well, you don't know, but Ekua has been a great leader to this project. She has been managing a lot. So I think that she also deserves a great applause for your diligent working. And as we have to wait for some people to join us, we just wait and thank you for joining us today.
Thank you so much, Vivian, for inviting me, and Ekwa for the dialogue. I will have to leave just because I took another appointment, but I really hope that I can have also some news from Tatiana. You can connect on LinkedIn like this. We can share also everything about gender violence, about what we are doing. And I think it's always good to have this kind of conversation. So thank you so much. And have the happy ending of the fellow, of the Ayoka fellow.
Thank you so much, Laura, for joining us.
Thank
and
you.
for all your work, which is impressive. And we talk soon.
I think that it's the same insight for us. Thank you, Vivian and Ekua, for the invitation and for joining this great fellowship in the whole year. And I hope that you finish it very well today. I do have also an appointment now, so I have to let you know. And it was great to meet Tatiana and to have the opportunity to meet also Laura and Olua. So thank you very much, and have a good end of the fellowship and the afternoon, and have a good weekend.
Thank you.
Thank you, Olka, for coming. Thank you, Anna. I'm happy to
Thank
see you again.
you.
I hope we can continue being in touch. And well, Juan Jaime had to be here, and he apologized. He sends you a hug and thank you also for joining. So, but yeah, he cannot come finally.
Thank you so much, Vivian. Thank you, Ekwa. It's been so nice and it's been very inspiring hearing from Tatiana. I think that she's doing something really amazing and bold. I was on the session yesterday, so I listened a bit to what the other fellows presented. And I just want to say congratulations to every one of them. I think you guys are doing a great job. Well done. I have to drop off the call now because I have some things that I have to. All right, Tatiana, I'm available to connect on LinkedIn if you're interested. And always just send me a message. Take care of yourself. Bye, everybody.
Sure. Bye-bye.